Hi, I'm Christy, and I'm here to share with you the story of the One Health. The One Health Clinic is an innovative model of side-by-side human and veterinary health care for people experiencing homelessness in Seattle. Ricky and his dog Bella are clients of the One Health Clinic. Ricky shared that this bench is where he decided not to end his life because he didn't know what would happen to Bella if he was no longer around to care for her. As he says, she is the reason I actually wake up each morning. Stories like Ricky's are common. Many people experiencing homelessness feel like they have nothing. No choices, no connections, except for those with pets. In 2019, over 11,000 people were reported as experiencing homelessness in our community. This number does not tell the whole story. Homelessness disproportionately impacts people of color, the LGBTQ community, and people with health issues. This is not a problem that is unique to our area. Nationally, 500,000 people are experiencing homelessness. Health and homelessness are linked. In many cases, a person's physical or mental health issue was a key factor in them becoming homeless, or their health became worse after becoming homeless. We estimate about 20% of people experiencing homelessness in our area have at least one pet. These are people like Ricky. At the One Health Clinic, we are tackling a cause of continued homelessness by bringing people into health services who were not previously accessing health care, all while improving the lives of animals. Healthier people are more likely to access other services like housing, which can lead to a path out of homelessness. To create the One Health Clinic, we added veterinary care to an existing weekly healthcare clinic. Since adding healthcare, the number of human patients has doubled, and not just on the weeks with veterinary care. We offer care for people and their pets at one place and at one time. We treat them like the family unit they are. The first time Ricky brought Bella in for care, he did not want to see the healthcare provider. This is not uncommon, as 32% of the clients we saw last year had not been accessing primary care. Ricky only came because of Bella. As he says, I will make sure she gets food before I do. Because of the care that we provided Bella, when we asked Ricky to just say hi to the nurse practitioner, he did so, albeit reluctantly. Over the next couple of visits, we built trust with Ricky until he too was accessing regular primary care. Together with our collaborative partners, we are showing how side-by-side care can make a difference in the health of people and their pets. This is not a model that others are doing. This is for many reasons, including questions around regulations and not knowing how to get started. Beyond providing care locally, we are creating a toolkit based on research and best practices to be shared across the country so others can be making a difference in their communities. This toolkit will include resources like how to get started, what partners are needed, and healthcare protocols. We are leading the shift away from thinking of pets as a barrier to an opportunity for improved healthcare access. By 2022, our plan is to be sharing the toolkit across the country so that others can make change where they live. We have already gotten calls from Colorado to Connecticut wanting to replicate our model. Our sustainable program leverages existing infrastructure, increases utilization, and is replicable. Your investment of $150,000 will double the number of clinics here locally. In addition, it will also make sure that the toolkit is ready and shared by 2022. We want it to become the norm for healthcare to be offered for people experiencing homelessness in the side-by-side environment. Shifting how care is offered will save lives. Join us in leveraging what we already know, Ricky's love of Bella, to drive change across King County, Washington, the US, and the world. Thank you.